Hello everyone, this is Afroberta and I'm going to start by inviting someone right now. Hello, can you hear me? Hello, can you hear me? Can you hear me?
I can hear
Okay.
you.
Oh, better now. How you doing? Sorry for the glitch.
Yeah, I'm very well. Sorry, I had to rush.
I know. I
I had
didn't
to
know
rush.
that TikTok was doing that, so
Yeah,
it's better
I
we just
forgot to
recording here.
mention. I forgot to mention that you need 1,000 followers before you can access that. So
Yeah.
it's fine. We are
I'm
here.
I'm
Yeah,
a newbie on that.
it's fine. It's fine. No
And hello,
problem.
Karen, because Karen sent me a message like, "Are we not going online?" So hello, Karen.
Oh, sorry. We are so sorry. It's TikTok. Oh, we tried. It's TikTok, eh? We are sorry. Welcome, Karen. Good evening or good
Yeah,
day, because I don't know your country.
yeah.
Thank you
I think she,
for joining.
and
Thank
whoever is
you.
gonna watch it later. Hello, everyone.
Yeah.
I'm Afri, and we've got healthful remedies. Yeah, healthful remedies, and yeah, we wanted to discuss about how to use Ewedu for birthing. You know, we know that there's so many advantages of the things that we can do with it. So I was saying that we need to introduce, like the background of why,
You're
we
welcome.
wanted to talk about this. You know,
Hello, Afri.
yeah.
Hey,
Can you hear me?
network.
Yeah.
Kind of on this network. Yes, we can, but the glitch is too much.
Okay. But is it better now or it's still worse?
It's it's better. You can continue.
Okay. Yeah. So maybe, yeah, you can, healthful remedies, you can go ahead and we can just record it from, yeah.
Okay. Thank you. Good day, everyone. For everyone that'll be watching this, good day, everyone. Thank you for joining this session. And what we actually stand for is how we can use how we can use natural measures to, to help ease delivery. And there are some misconceptions that I would like to correct before we start. In a situation where you get to the hospital, one of my bosses, yes, Sonia Media, thank you, sis, thank you so much, good evening. Yeah, so in a situation whereby maybe you are pregnant, and then you got to the hospital. When you get to the hospital and you've been trying to deliver, and they started telling you that, oh, the baby is in distress or the mother is in distress, please don't wait for Ewedu. Go into the theater and hand everything teaching here tonight, it's something that you need to start at least third trimester, so that you will not be in that situation where the baby is already in distress or the mother is in distress. It's something that will help to fasten the process for you, that when it's time for you to deliver, within a twinkle of an eye, you are done. Much you are done. So if you've delivered through cesarean section before, you are still a champion. If you've delivered through vagina, you're a champion. There are some things that we can't correct again, so you don't start feeling bad. You understand? But you can help others, educate others, teach others about it. And I want to start with um, the material, the major thing we're talking about, which is Ewedu. The English people, the English name is jute leaves. I don't know if it's jute or jutes. I don't
Yeah,
know.
I heard it's jute leaves.
It's sure jute leaves. You can check on Google. You're going to see it. Beside what?
Yeah, I heard it's jute leaves. So I always say yeah, jute as well.
Okay,
I said it's jute leaves,
jute.
but yeah.
Yeah, jute. Sorry. Leaves, okay. Jute leaves or ewedu in Nigeria, I think it's very common to us Nigerian.
Mm-hmm.
Ewedu, even Igbos, everybody, but I also call it is it nama or something? I also call it a name. I think nama or thereabout.
Okay.
So that is the major ingredients, major thing we need or we are looking into. And how do we use this? Ewedu is actually very good. This juice leaf is actually very good and it's nutritious. It has potassium, magnesium, zinc, fatty acid, and omega-3 in it, and it is very healthy for consumption. So let's start with the fact that even if you are not pregnant and you want a total wellness for yourself, please ensure you add Ewedu to your meal. In fact, you can drink it alone. You find it difficult going to the toilet, you are always feeling pain, or you're sure not okay with your health, or you want to achieve total wellness, you're looking for something that will make you look good, anti-aging properties, that is juice leaves for you. Just go for it, eat it every now and then, and you'll be glad you did, because it is very very rich and it is okay. So now let's go to using it for pregnancy. um my own experience now, I think 2016 or 17, I can't remember the year, but I know it's either late 2016 or early 2017. i was i was um I was not licensed then, so I was just going to one hospital like that. Sorry, I was just going to one hospital like that, and I'll just go there. I was learning like an auxiliary kind of thing, but they don't allow me to practice, so that they're not gonna carry them. I was not allowed to practice, but I always go there, learn other things. Like we had a pregnant woman. She came into our clinic, and for about 6 to 8 hours, she has been trying to deliver. She was a pregnant woman then, and we've tried all we could. This woman, if you are a nurse here, you understand when I said someone is already in 6 to 8 cm. That means this three hand, for my hand that is small, four hand is entering, and for bigger hands, three hand is entering. If you are a nurse, you understand that there are some hands that they will put hand there. They will tell you this is just two. I know you are putting your hand, they are saying like four. So my hand is just like 8 cm, and the other person said, oh, 6 cm. So since then, I'm always saying, oh, 6 to 8 cm. So we are really seeing the baby's head. There is head in perineum, and the woman was finding it difficult to push.
Hmm.
She tried to push, and we are not achieving anything. So immediately our boss is a medical doctor. He came in and he was like, what happened? Since morning I went out. Sir, we are still there. Oh. Then he shouted my name. Hurry! I was like, sir. He said, go and cook a redo. So I was even surprised that, sir, we are in a very serious situation. My boss wants to eat a redo. That was my thoughts. So he was just shouting, go and cook ewedu. So he asked someone to follow me. We cooked the ewedu. We used potassium. The
Mm.
normal way you cook
Yeah,
ewedu, the jute leaf at
yeah.
home. So we did not add salt, maggi, no seasoning. We did not add locust bean, nothing. Just the
Okay.
potassium and the jute leaf. Then we ensured that it became very soft. Then we used that small broom.
Yeah.
We started smashing it till blended, no, blended to a large extent. Then we poured it in a cup. So immediately we got to him, said, bring the cup. And when we gave it to him, he gave it to the woman, and the woman finished the cup. She was already tasty
Hmm.
already, sef. So she was just gulping the whole, and then she finished it. And she said we should leave her, but we should stand by.
Hmm.
So the matron was standing by, everybody was standing. I don't know. It was like a miracle to me that day, actually. I was just like, hey, what are they doing? This
Hmm.
woman is in distress. They are giving her a
Hmm.
rate. Is she hungry? So we that we are actually there to learn, they don't really allow us to practice because my is a medical doctor. He will tell you, you not allow you to use people to practice. He
Hmm.
doesn't like error. So, but we just stay and we learn. So the matron was there, one nurse was there, attendant too was somewhere there, that anything just clean up like that. So the doctor too he was there. So we were there, and then we didn't. So he told the woman to lie down, and he told her to reserve her strength, that when the time comes
She would
she
know.
doesn't even need much of her
Exactly.
strength, that you will see something. So me too, I was expecting miracle. So within five, let's say maximum of 15-20 minutes, I can't remember, but I knew that it was within short period of time. I just say that I had like this baby placenta. What's this?
Wow.
Like, it was so smooth, no tear, nothing. It was so smooth. Though they already used olive oil to lubricate the entrance, but it was so, since that day I was like, wow, this was a magic. Like, it has been a magic to me. Like, till date, when I remember, I still like, lighting up like a little child. Like, so something like this can actually work. So since then, I've had the knowledge that just leave it. It's actually very good for delivery.
Hmm.
And that is what we're talking tonight. So before I continue, I'd like Afribeta to also tell us your own experience. Then we go to how to prepare it for pregnant women, for everyone to learn. Then you can always tell people around you. Thank you.
Yeah, thank you so much. Thank you so much. Like, it's very interesting and it's very important that we share this kind of stories because people don't understand. I've heard it when I was watching a Yoruba movie before, and like, but it doesn't register in your head until when it's your time, and
Yeah,
then you
that's so true.
realize that, wow, like these things do happen. So for me, my experience is so different because I've had three cesareans and it's always having to be long labor. The one of them I didn't even know I was in labor, but a story for another day. But it was more of like the doctor was like, once a cesarean, always a cesarean, and just like took me to the theater straight away. So that's another story for another day. We would definitely delve into that. But this last baby, I did a lot of research, you know, because my third baby, I was using red raspberry leaf tea because I'm in the UK and I was thinking, oh yeah, there's no need of going the African way. Let me just try what they're using here.
Mm,
But that what we don't understand is that our bodies are different and we're from Africa.
yeah.
Things that are from Africa are our body. We are from there. Is what we should actually ingest. You know.
Mm,
So my fourth baby, I started drinking Ewedu from my second trimester because I don't really usually eat Ewedu with my swallow. So I knew that I had to incorporate it into my diet. So I would just blend it with water and drink it. But I was drinking it bit by bit because I asked about it online and a few people said, oh, I should try it.
mm,
And that was what I was doing. But in my third trimester, I was taking it like twice a week, you know, making sure that I consume it regularly. And it was just interesting. I was thinking it was going to put me into labor early, but it did not. So I was already 42 weeks according to their calendar. But for me, I was counting it, I was already 40. I was 40 weeks then, but the dating of the scan is different from my own date.
mm.
But I knew that
It's
I was
okay.
within that range of like was time to give birth. So I didn't go to the hospital. I didn't go to the hospital to get induced like I usually do because I just felt like I think I'm going to listen to my body more this time around instead of having to, go to the hospital, get induced with artificial oxytocin or stuff like that. I just felt I'll just stay at home, And I just kept on drinking my Ewedu juice. And that was it. I usually have my pineapple. I did like a blending of pineapple core and just what's it called? Like a teaspoon of castor oil just to get my body going. Because I was feeling contractions here and there before. And that was it. By the time it was time to give birth, at 10 o'clock I just started feeling contractions and everything just went from there. Within 2 hours in my house, I had my baby. The only thing was that I prepared another Ewedu juice that if I'm in labor, I thought it was going to be the long thing that I was experiencing every time I go to the hospital. I was expecting like a long night. But within 2 hours, I had my baby. When I had my baby by like 12:05 or so in the middle of the night, and within 15 minutes, the placenta came out. Nobody touched me because I called the paramedics because I've never done that before. So I was like, let me just call the paramedics just in case. And they
Anything.
just left me. And she was like, the placenta is just coming out bit by bit. Because I was on all fours. And that's another thing that we have to talk about, the positioning of birthing as well. The way you birth. I was not lying down. I was on my ball, the exercise ball, like a yoga ball. I was bouncing on it. I was changing position on my bed, on all fours, on my sides. I just kept on changing position. So those things matter. But the Ewedu juice, I had already ingested it that day. And everything just came out like that. It was, and they couldn't believe what they were seeing. And that was my own experience because I just made sure that I was doing everything that I had to do. And it was just a different experience compared to my previous birth. I don't know if you're still online. Can you hear me? Can you guys maybe you can hear me? Because I think healthful remedies is offline now. So if you guys can hear me, just that's the story. I'll just wait for her to come on. But kindly give a reaction, a wave if you can hear me. Karen, Sonia, it's good to have you on here. I'm just gonna wait for her to come on. Yeah, there was a glitch there. Can you hear me?
Yes, I can hear you. I don't know. I think my network is not. I don't know if it's from
Yeah.
me, but we can hear you now.
Okay, but did you hear everything that I said, or where did you guys stop hearing me?
Yes. Karen, where did you stop hearing? I want to be sure because it was breaking along the line,
Oh,
and
what's it?
I want to be sure she really had you wrong. Okay, let's start from the paramedics, the sitting position,
Yeah, so I was
the
on all
position.
fours.
Oh my
Yeah.
God,
So I was on all
network.
fours in my bath. Yeah. Let me try and move. Can't
Yeah, I tried
believe my
to
network is
move and
failing.
let's see. I don't
Yeah.
understand.
I just move and try. Hopefully it will get better. Is it better? Is it better?
Yeah, it's better now.
Is that better?
Yes,
Oh,
it's
I should have.
better.
Okay. Yeah. So I was on all fours, and then yeah, the placenta came within 15 minutes, and that's the fastest and the easiest I've ever had it. You know, and then since then I've never wanted to be quiet. About all these stuffs, like letting people
Okay.
understand that we have this stuff and we just taking it for granted. Not that we're taking it for granted, but it's not being passed well from generation to generation. There's like a break in transmission somewhere, especially for people that are in diaspora, people that are in the city. There's a break in transmission somewhere, and we're not documenting it well enough for people to understand. And maybe
Mm,
because people don't have access to it, because like I was spending a lot of money buying it every week because it's imported, and there isn't like the dried version of it, unlike the red raspberry leaf tea that was readily available and I could use it because they already dried it. I'll just warm it, brew the water like tea and drink it. But the Ewedu, it wasn't like sometimes you might not get it. So I had to be buying it in bulk to freeze it and be using it later. So maybe those are the things that are not making people in diaspora use it more often. But people in Nigeria and in Africa, they're still not using it. The cesarean rate is going higher and higher every day. And yeah, it's not nice to hear that or read about that at all. So that was my own experience personally.
thank you for sharing. And one thing I just want to correct is sometimes I don't blame Nigerians because
Mm-hmm.
I worked in one particular hospital like that anything that has to do with alternative ways, they will just frown at it like, what are you bringing? Like somehow like that. And especially these private organizations. I'm not trying to ruin anybody's work
Yeah.
or business, excuse me.
Mm-hmm.
But sometimes when there are opportunities, you don't close the door to people,
Mm-hmm.
but because they know, like they already had the knowledge that if you try this, it's going to work, and the rate of cesarean section would reduce like drastically. They would block, in fact, they would create a certain fear
Mm-hmm.
in some women to the extent that for you to even drink that thing, you'll be like, hey, don't let me drink this thing.
Mm-hmm.
My doctor said so
My
because
doctor
of
said,
the
mhm.
selfish reason. They want
Yeah.
you to come and do that because they knew that you are going to pay. Now surgery in Nigeria is about 250 to 300. If there without other story, it's just if there is extra bleeding, excess anything, they will add extra 50,000. They will count it for you. Extra 50,000. So I think they are just doing it intentionally, but it's left to people
Mm-hmm.
because I always tell people, even in my own personal group, I'll tell them it's you.
Mm-hmm.
Personally, if I'm talking to some people, I'll tell them, if you like, I had a woman like that. She's always having pain. No, she has fibroid,
Okay.
and the fibroid is very little, like very tiny. So I told her, just try to do this. I actually gave her some. She said, her doctor said she should come and remove it as soon as possible. I said, because okay, she now said, but she's scared that she heard of people that they said is going to there will be regrowth. I said that's the fact. So it's
Yes.
better for you to use natural measure
To
and allow this thing to
melt
die
it away.
entirely. You only want to
Mm-hmm.
go and cut it. This thing is hormone. You want to go and cut something, it will come again. But
Yep.
the doctor has created a fear, the fear into her
Mm-hmm.
that she said, oh, I said, madam, if you are not like if you are not convenient with what I said, please go ahead with your surgery. That has been about 2 to 3 years now. This person is having the regrowth presently. Now she's coming back. I said, I'm not after you. In fact, I dish out free informations. Everything
Yep.
is not money.
Mm-hmm.
I dish it out to people. That time I did not even ask her for anything. I only told her to go and buy castor oil and other things. That just massage your tummy, do this, do that, and you'll be fine. Get this supplement, it will help it. That was all. I did not ask her for anything, but she gave doctors money. So it's left to individual to now see to it that this thing is, it's more about me than these medical practitioners. I'm also a medical practitioner. I work in hospitals, but I will still tell people, I still tell my patients sometimes that, see, this thing that is disturbing you, go and use this thing and this thing and this thing, you feel better. And on many occasions they will tell me, oh, they tried it really worked, and that's that's why they call us lifesavers. So
Mm-hmm.
why should we be now imputing what is not into people? So I wanted us to go to how to use it. So you'd have to share the way you use it, or should I go first?
Uh,
Which one? Let's share the way to use it, and also
For
how to use it
me,
for conception.
for
Then
me, I used the I think I just blended it. So I just blended. I chopped it and put it in a blender with a cup of water, and I just blended it. It was slimy, and I drank it. I tried two different methods actually. The first one was the blending with water. The second one was that I wanted it to, like to be very slimy, just to feel that effect of that sliminess. So I put it in a bowl and I put a little bit of water and I was using my hand to like squeeze it till I saw that the water was slimy. Because I wanted to have that, especially when I was in my third trimester, I wanted to have that slimy effect, So I kept on doing that till it was slimy and then I drank it and I just kept on squeezing it. I was drinking the juice that comes out of it from squeezing it. And then I'll just leave the leaf, blend it without not throwing it away, and just blend it and just drink it normally. That one is slimy, but it's not as slimy as if you use your hand to do it. And I've seen people say that when you cook it, like you would just cook normal Ewedu, like you mentioned, with the potash, or just not just cook it, just and use the broom to do it. Because I think what you're looking for is that slimy effect as well.
exactly,
The leaf is very powerful, but you want that thing that
the
like castor oil
strength
as
is
well. Exactly. Castor
yes.
oil is very thick, but it's a bit slimy as well. And it is the one that causes the, what's it called? That helps with the constipation and everything to just flush out the system. So I think you want that effect. So that was what I did on my end, and I just kept on doing it regularly throughout my third trimester.
Yeah. And the way I've seen people use it, I think I asked someone earlier, one of those how do I call the man now? He specializes in how to use herbs and everything. He's not
Okay.
herbalist now.
He is
He's
an
still
herbalist.
herbalist.
He is a
Yes,
herbalist, and
still
people don't
herbalist.
understand. I think
So
they're taking that word so
yeah,
serious. Yeah, people
so
are
they always think
specialized, certified
I remember,
herbalists.
you know what? I remember the first time I told someone that I'm a clinical herbalist. He said, I said clinical. Clinical now. Say, but other herbalist, are you doing charm?
No, no,
Africans,
no.
this mentality on your head, I'm tired.
We'll get there. We'll
So I
get
think
there.
you mentioned that there are some people that they can't drink it raw.
Yeah,
It can make them to vomit.
yeah.
So he said that's the reason why they actually encourage drinking it, like cooking it rather. So I think that's just, it's not as if there is any difference.
Mm-hmm.
It's just that, like me, if I drink it raw, I might throw up.
Yeah,
Yes. So there are people like that. But so he said you can just cook it. That either you cook it or you're using it raw, just to ensure that you use, the strength is in that thing that you mentioned. That it's not as
exactly.
if it's not as if there is anything so big about
No.
it, but for you to absorb all the nutrients you need, the
Mm-hmm.
magnesium, the omega-3, every strength, the
The
potassium you
folate
need,
as
so you
well.
can
Yeah.
actually absorb like drink everything. So you can cook it like your normal juice leaf. You don't need to add seasoning. That one is just wasting
Mm-hmm.
of time, stress, and everything. Just boil it, blend it, and after blending, drink. But I always prefer it in third trimester so that it will not ignite. How do we call it
And
now?
start
This
labor,
one, the
premature labor stuff.
yeah, premature labor. Thank you. So you want to use it in your third trimester, like from 7 months, 8 months, and from 9 months. Just keep drinking it every now and then. Keep drinking it every now and then,
It should be your
and you really love
juice.
it because yes, it's like juice. Because it's time for you to deliver, in fact, you'll be like I told someone that the issue many people they have with deliveries, because they will tell them that you're first time mothers, and fine, it is the facts. Delivery might stay longer for a first time mother, but if you know the shortcuts, why
Yeah.
not give it a try? Why not try the
Yes.
shortcut? You don't need to
Exactly.
wait for how many hours, like because they said I'm a first time mom. I beg, first time mom or no first
It
time
is.
mom, if you see a
It's not
shortcut,
true.
because I believe that at that particular time the person is in pain, so you don't want to keep elaborating the pain, keep prolonging it. Why not do something that will make it very fast? So I think that's just how to use it. When you prepare it, drink it every now and then in your third trimester, and commit it to God too, because it's going to work for you the way it has been working for everyone. Even me, I already had it in mind that when it's time like this,
It
Ewedu
should be your
vendors, we
juice.
know that
Yeah.
someone is in this environment, because I can't see something that is easy and I'll now be looking for what's
What's
not.
not
I beg. Money for surgery, if you use it to even do shopping safe, you know that I bought something tangible. Talk
exactly?
less of the pain, the scar,
But
the
what I wanted to
stress. Oh,
mention was that you said when you administered it to the lady when she was in labor, people don't
mm,
realize that they can actually eat and drink during labor, and you can
yes,
actually
very well.
drink because you'll be so dehydrated and you need that energy.
Yes,
So choosing what
yes.
you drink and eat
Oh,
during labor is what matters. Most of the time, why they are
mhm,
starving you is because they want to prepare you for surgery. That
exactly.
is the
Some people
reason
will
why
not
they are
even bring
starving
anything.
you.
Some people will not bring anything.
They
Some
won't bring
people will be like, my
anything.
patient said I should not bring anything except
No,
glucose. And
we
that
need to
glucose, the only drink is
go past my doctor said. Doctors are
yes.
human beings
For
first before
the
anything else.
actually,
They are staffs
yes.
of the hospital first before anything else. That's one thing
Mm,
you have to realize.
mm.
Your pastor has said many things. Your imam has said many things. How many of it have you followed?
It's the pastor
And
one
that's one
that
thing.
the doctor will they put
You
on their
understand that
heads.
you're putting on your head, as long as you've gone through all your tests and everything says it's fine, then you have to put
Mm-hmm.
your own faith into your own hands. I've been so innocent. If you see the way I packed for my induction, the induction that I did not need, my body was not ready for labor, but I went through it. And they're like, "Oh, you are in distress. Your baby is in distress." The one that actually pained me was the one I said, the second one. I was actually in labor because I was already changing position, squatting, and he just checked my note and said, "Oh, she's asked cesarean before. Why does she want a natural birth?" And
Wow.
I was already in active labor, so my sense was already out of the window. Of course, when you are in active labor, that's the when you cannot make a decision by yourself anymore. So, but if you go there with so much intention, and there is nothing in being in labor at home, do everything, be in your natural environment, keep sipping your Ewedu juice, take it to the hospital with you. Have your husband, your partner, your mom, anyone that is there know that these are the things that you want to do. Have a birth plan. Just write it down so that you give it to anybody that is going with you that this is my intention. I know exactly what I'm doing. I just want someone to be my brain when my brain has already, my brain is focusing on actually pushing the
Please carry
baby out.
all the brain.
Exactly. Be my brain for that time. and just keep on sipping. You're allowed to eat and drink. Just you drink the right
You
thing. So if you're eating
don't allow
pineapple
yourself
during
to
labor,
change it for them. It's not my stomach, I
ex-
beg. Except on serious condition, maybe
of course,
you have hypertension in that
of
process,
course.
emergency,
Yeah,
something. If there is nothing, I beg, tell them I need to drink. It's a juice.
because
I need to
I know that
drink.
people drink okra water as well. You know, anything that will
Yes,
help your
okay.
labor go. Labor can go as low as 30 minutes to 1 hour to 2 hours to 3 hours, or even people go to labor and within 5 minutes they're giving birth. It's not by magic, it's the things they've done before that day. And
Mm,
I know as a health practitioner like you now, for me, I did an experiment with this my last child in terms of the dating. People are like, oh, they gave me this particular day for giving birth. And they keep on telling you that it's EDD, estimated due date. Estimated that the machine has calculated for you. You can give birth before, you can give birth after. I've seen ladies that give birth 43 weeks,
they will
and I
even tell you
calculated my own.
after.
43 weeks as per the machine. I calculated my own. I kept on telling my husband, he said, oh, it's 42 weeks. I said, 42 weeks in their machine, but I calculated my own period, my last day. Today that I'm giving birth is the day I'm 40 weeks.
Hey,
You know, the service has gone down a bit. If you guys can hear me, just reply because I don't know if it's the service on my end that is fluctuating. But thanks so much for joining Pinberry. And we'll record this as well and then share it on Instagram later. So kindly say hello if you can hear me. All right, all right. I'll just wait for her to join quickly, but I hope this is like motivating you guys. I hope it's inspirational. I hope you can understand, You can eat and drink, you during labor. As I said before, just choosing exactly what you eat and what you drink matters. Your pineapple, it helps. The Ewedu juice helps, especially when you are in labor and you can feel that pain. The only way you can get out of that pain is to do something actively that would help you give birth quickly. Lying on the bed is not an option for you. Moving around, not moving around in agony, but swaying your hips left to right actively. I've shared so much on my page on the positions that you should take when giving birth. The hospitals are just catching up, and as Helpful Remedies said, many of the things that they're doing in the hospital is just based on things they've known in the past. So if we keep talking about this stuff and other alternatives or other things that our mothers have done before, you know, yeah, sorry. Good to have you back now.
thank you. The network is just going
You know, I
here
was
and there.
I was talking about, the positions and then not having to lie down on the bed when you're
Mm-hmm.
giving birth. It matters a lot. I know that we watch it in the movies, they tell you to lie down. It's just for them to be able to have access to your vagina to check you. That is the reason why they're telling you to lie down on the bed. All the
Sometimes actually, medically, if you are lying by your left hand side, it helps. Actually, it helps delivery. But many times, it's better for you to do exercise.
it's
Like
better.
there is this, you have a lot of informations about this on your page, so we can
Yes,
always check it out.
this is
Afri
what
Better on Instagram,
telling
you
you.
can always check it
Hmm.
out. And another thing is because I've seen a situation where it's not just about, yes, sometimes because lying down might make you feel lazy. Started
Mm-hmm.
feeling cramps on your
Mm-hmm.
legs, pain, and you just be nursing it. But if you can just stand up, do exercise, try as much as possible. But I
Mm-hmm.
think the best thing is before your EDD, before your due date, start the exercise. Start doing exercise, start practicing all of this. So I can assure you that even when it's time for you to deliver, you don't have to wait long, for a long period of time. You understand? Because when you lie down there, sometimes you tell some people to lie by their left. Before you know it, they're already on the right hand side. They're already, hey, nurse, hey, come. They'll be the ones who will come out to tell you, oh, yeah, come and put your hand, come and check, come and that thing is painful.
It
I've seen a
is.
lot of
Oh
women. A
gosh.
lot of women will
It
cry. They will be
is.
it's painful. It's and after delivery, that site will now be very painful. You now
Yeah.
start feeling unnecessary pain down there again, coupled with the childbirth's pain and everything, the delivery
Mm-hmm.
pain. So it's not good for you to just stay there alone. It's
Mm-hmm.
not easy. Yes, we know it's not easy, but you are the one, you are the only one feeling that pain at that part. Nobody can bear it.
And you're
Nobody
the one
can
that can
understand it. So if you
help
know your
yourself.
yourself, you are the only one that can help yourself. The best thing we can do for you when you come to the hospital is we can help you to hang a drip to
Mm-hmm.
help you. And another way we can help you is to transfer you to the theater if you are not responding or if that's the next thing to do. So before your baby gets weak, before you yourself get weak, start your exercise. Start your exercise. If there is staircase, try as little as much. Climb, go down, and just do little and minor exercise here and there. Before you know it, your baby is there. Do not sleep there. Some people too, let's be sincere, some people too are just, I don't know how to, oh, don't touch me, oh, don't do this, oh yeah, stand up, no, I want to stay. Like, they are stubborn, let me put it that way. Some people are stubborn, and like that you have no choice than to just, when the baby is in distress, the mother
Mm-hmm.
is not responding,
Yeah.
abeg go to the theater. So I know it's painful, but that's not the time for you to now start showcasing, this thing you don't need to tell us again.
Hmm.
We, in fact, we are aware
Hmm.
that it's, but you yourself, you know that this thing is not easy, but let me just keep trying. And before you know it, your bundle of joy is here. Because even in the hospital, they will not want you to lose your baby. Truthfully,
At
good
all.
hospitals, they will not want
Nobody does
you to
that.
lose.
Yeah,
They
nobody
will
wants
not want
that.
to lose your life. So when they see that you are not cooperating and the baby is in this stress, someone before you know it, they will lay the bed. Oh yeah, go and do surgery, because 9 months journey is not easy.
Yeah,
You
at
have to
all.
carry your bundle of joy home. You have to be alive for your child too. So you are the one that will not be lazy. You'll be the one to pick up yourself and just try it. It's once and for all. And the Lord will strengthen you.
You
Thank
know
you.
what you said about the stairs? You know,
Yeah.
on that day, my surgery was, I was booked for surgery 2 days after I gave birth. I gave birth on a Sunday slash Monday, and I was due for surgery on Tuesday. So I went for my
I
pre-op on that. Yeah, because they were convincing me to have surgery because I've had cesarean before. But I wanted to go
okay.
natural
So
as
before child
in
delivery, before you
for the for the
delivered your
for the
child.
for the yeah before I gave birth to my child. So
Okay.
when you mentioned about that stairs, on that day, around before I
Hmm.
started labor 10 o'clock. On that day, I felt so down. And but what I did was I just kept on going around. I did I read about the oxytocin level as well, happiness, joy.
Body.
I did that with my family. We watched a movie together. It was so nice because
It should be
we're
I.
preparing for baby to come. Whichever way the baby comes, we don't mind. But I was on my exercise ball. If you guys have this yoga ball that you see that makes you bounce up and
Yeah.
down, it's like, yeah, I was just sitting on it. And as I said before, I drank my castor oil with the just a little bit of castor oil with the pineapple. But what I did extra when you mentioned the stairs was that after drinking it, I didn't know what was gonna happen, you know. But I went on the stairs because we have in the UK we have stairs inside the house, not outside. To
Okay.
go up the stairs, it was inside. And there's this thing they call them side. So you're climbing the stairs, but instead of going straight up, you're going sideways, and you're going two stairs
Okay.
up instead of just one step up. I've been
Okay.
doing that few times, but that day I just felt like, let's just do everything. Whatever happens, happens. But I didn't even know I was going to labor. But I was doing that up and down. I timed myself for 20 minutes. I did that, climbing two steps up, two steps down. I was breathing so like really high and everything. But I just felt like I was just going to do it. People don't say the things that have actually led them to having a successful delivery. There are things you do unconsciously. Some women say, I just walked to the market. Oh, I walked for like 2 hours. What do you think what you were doing? The things that you did that facilitated your labor to be so fast. You didn't just go into labor and delivered within 2 hours or 30 minutes. Try to think about it. There are some things that you've been doing. Some people
Yes.
they usually have sex all the time. Some people they just feel that they were in labor, they just felt cramps and they had sex. And the next thing
Yeah.
after sex, you'd be like, oh, I just felt I was in labor. No, there are things that facilitated you to actually have a successful delivery. But if you know that you don't usually do some things, think about it and write it down. What are the things I'm doing in this pregnancy? Especially in your third trimester, and start ticking your boxes. Having sex regularly, exercise regularly, drinking your Ewedu drink or
The yoga
anything that
ball,
is yoga
dancing.
ball, dancing. I see women dance and they be like, oh, dancing puts me in labor. But
Mm.
it's not about, and if you dance and you don't go into labor, your body is not ready.
Yes, it's not
Especially,
immediately.
it's not
It's something
immediately.
you practice even before your delivery day, not just that day you now start.
Not on your EDD that you start. And if you start on your EDD and you don't go into labor, that means that your body is not ready. As
Not
long
ready,
as they
yes.
say that everything is fine, your water level in your belly is fine, the baby's heart rate is fine, just know that you can do everything possible to facilitate a positive experience. Hospital is not the place to labor much because they have so much going on there.
You
So
don't expect
much
them to
going
be
on.
on for
They cannot
days.
attend to you as much. But if you have your own at home, do everything possible. Even if you feel like you have anxiety and you don't want to give birth at home, move close to the hospital, drive close to the hospital. Maybe every day, be driving close to the hospital or moving close to the hospital so that if anything happens, you're close to where you intend to give birth. When you're close to when you are past your due date. But I wanted to ask you something about what you feel about induction. And I've seen that I think it's because many people are practicing here in the Western world and opening their practices in Nigeria and in Africa. I think they are bringing so much of the things that they are doing here and they're taking it to Africa. And they're trying to say that ignore the status quo, like the things that we are doing in Nigeria, and just focus on, the cesarean stuff, giving induction at 37 weeks, 38 weeks. You hear your doctor say, are you going to be induced? You know, as someone that is into the health system, what do you think about that? I just want to chip that in. I know we didn't mention that, but it just popped into my head now. What do you think about that?
I can't hear you. Network is breaking, so I can't really hear you. You said something about induction.
Yes, at 37 weeks, 38 weeks, doctors asking pregnant women
Is it
if they
me?
want to be induced. What are your thoughts on
For
that?
delivery,
Like,
right?
yeah, for delivery, they want to be induced at 37 weeks, 38 weeks. It seems like it's something that was brought from here in the Western world because they're trying to, of course, to reduce the is it mortality rate or maternal mortality rate. These are the things that they are
Yeah.
bringing in, I understand. But for someone that does not have any health issue and everything is fine, it seems to be a norm now. What do you think about that?
My own is, earlier we mentioned about good hospitals and the bad
True.
ones. There are good hospitals that they will table options before
True.
you. Immediately you realize that you are pregnant.
Mm-hmm.
I'm fortunate to work with one good hospital like that in Ilorin, Maxi Health Hospital. They will
Mention it,
place,
please.
seriously, they are very good. Actually, if they are not good, I won't mention their name.
Mm-hmm.
But these people are very, they will table the options. We have the option of induction. Do you want a serious session? Do you want vaginal delivery? And of course, many people will tell you, oh, vaginal delivery. So they will now start educating you.
Hmm.
Do this, exercise, eat your food, come for antenatal, and a lot of things like that. And I can say that 80% of our women, they deliver through vaginal delivery.
That is
Because
high.
even the surgery, yes, the gynecologist that will do the surgery, she will be on your neck that you need to practice everything. Before I will take you to the theater, I want to know what is wrong with
Hmm.
you. So even at the point where you are not cooperating, they will hold you. Oh yeah, everybody will let her deliver. Nothing is wrong with her. It's a private hospital, but they tried all their best to ensure that it is vaginal delivery. But I said there are some. I worked in Lagos too, and I saw a lot.
Hmm.
Yes, I can't even mention names. There are some that you know that these ones they want to do it for the money.
They want to do it for the money.
They just do it for the money. Although there are some people like people that are sickle sellers,
Yeah.
like the sickle cell and patients,
Yeah.
they can no, we are aware that it's because of the health condition,
Yeah. Underline.
not that we. Or you doing it for some. My own thought is, some people are just unnecessarily. I don't want to use the word wicked. Let me say dramatic, especially some private hospitals. They are just unnecessarily, like, once they travel outside of Nigeria
Yes.
and they see anything like this, they're bringing it back to Nigeria.
It's a
They're not
trend
even
that they're
thinking.
bringing,
And
isn't it? It's like the
yes,
BBL thing and all the rest.
don't mind it. And they will not ask you if you are convenient with it. Immediately you come in, they will tell you you're going for they will not start using medical terms for you.
Uh-uh.
You're going for induction, you will do this and do that. So I'll just I'll be looking at what's I'm a nurse. I don't have any power. It's only the doctor and the CMD, chief medical director. So I can't see anything. But within us, we knew that these things are
It's
not
not.
right.
Hmm.
And patients, you can't really know as a patient,
Of
because
course.
every one of us, we are obligated to respond according. So you can't know. You don't expect me
Actually.
to lose my job telling
Of
you.
course.
And most patients too are funny. They'll be the
Hmm.
ones to now say, is
You
this
not
your
so
nurse
so
that
that
said I
said
should
it.
do this or this one? So
Yes.
I'm always mute.
Hmm.
Except I have a cordial relationship with you as my patient. So if I have patient that I don't even pass my boundary. Doctor said I should use paracetamol. Madam, go to the pharmacy, go and get your
The
paracetamol. And
customer.
I have some that I will tell them, when you get home, drink a lot of water, have a good shower, look for somewhere cool and go and sleep.
Hmm.
You'll be fine. And they will obey me.
Hmm.
They will tell, oh, every remedies, I trust you. Let me go and do it. And they will come back. But there are some people that
Of
even their
course.
husband, they will tell the husband will now go back and tell the
Exactly.
doctor,
Please mention the husband's part. The husband's part. The
the
husband's
husband is now
the the husband's one. We need to the
yes.
men on this men. Husbands of pregnant women.
I had one experience like that. There was this person, the woman always have severe pain on her leg. In fact, the woman has graduated from paracetamol to ibuprofen to higher pain relief medications. And I was like, this woman, all these things you are consuming, you don't need it though. I was thinking within me that you don't need it. Just go on sugar strike and get coconut oil, massage this leg. You will not buy medication
Hmm.
again. And then she's actually overweight. So I was thinking that she can work on her weight. I was just thinking of a lot on my head. So along the line, the medications she was buying from our hospital was quite expensive. That whenever the husband is about to pay, you just be like, hey, we have started again, this pain. So one day we were talking, I met her, then we were talking, then I told her that, if you can try this thing, we can go on sugar strike and drink water, get coconut oil, then rest, and then work on your weight. I sure told her a lot of things, my mouth. I told her, and she now said, oh, Auntie Nurse, thank you. Thank you. The next thing, I saw them in our hospital with the husband.
Oh no,
they,
saying that you
they just
said
went
this.
to me. They don't greet me. They just went to the doctor's office straight and they started like, this your nurses. You need to watch them. Like I'm not bringing my wife here so that they will be discussing her life health challenge. I believe that they discuss within themselves. That was why this one has the audacity. I
Wow.
don't understand. Was it gossiping? Like I came to tell you something that will be benefit instead of spending on medications. So since that day like this, before that time, some of my senior colleagues said, "Oh, that the issue of husband self is more than that of
It
wife many times. That you see
is
husband that will
many
tell you that
times.
this pain is too much. Take my wife to the theater." Some
Yes,
husband will be like, "My wife is pregnant. She's not taking this. She's only taking doctor's prescription." So you see that part. I think it's men that needs to be
we
enlightened.
need
But
to
you know.
enlighten them a lot.
Men are adamant. They just want to follow their doctor. So
So I guess it's
if the husband now,
women that we have to say, my body, my choice.
uh,
But at the end of the day, if you don't want to lose your husband, how would you say it? Because
you know, you can't say it
husbands
though.
seem to be the babies in this situation. Because my situation as well, I had to put my foot on the ground and say, this is my body. This is what I
I'm
want. It
responsible
was like, okay, let's
for
just go
you.
and book the cesarean date. I was like, okay, let's go. I respect you. Let's go and book it. But I'm not going for that cesarean until when I feel like I've done everything possible to make
And
sure.
it's not
It's not because I hate
working.
cesarean. It's not because I hate cesarean. And I said I will talk about that as well later on different episodes.
I find
But the
God
thing
in
about
it.
it is that cesarean is a major surgery no matter how we look at
Every
it. If
part
you
of the
watch
body.
the procedure, if you watch the procedure, you'll see that it is a major surgery and it's something that can be avoided in many cases. Cesarean was brought for situations that needed cesarean, that needed operation. It was not for everybody, and it's not meant to be for everybody. That's what we're trying to say here. We're not against cesarean in
At
any way, but
all.
we have to understand that you imagine you can't go to toilet and your option is to do surgery
You
because
have
you
no
couldn't go to
choice.
surgery for. But imagine that they're actually telling you that go to surgery because you can't go to pool for 3 days. That is the way these situations are in some cases. They literally because it's just there. So I just want everybody to understand that we're not against cesarean, but there are many other remedies that are out there that can be used. And and healthful remedies has been saying a lot on our page in regards to options that are out there for us as human beings, as Nigerians, as Africans, and even people in our diaspora. And if we don't start packaging this stuff, even white people and the rest of the people don't know about it. I was talking about it today that I think the best thing to do with the Ewedu is to dry it, like the way for the raspberry leaf tea.
Mm-hmm.
Dry it and blend it and put it as a powder. And we can try it with few people. We'll talk about that later on how to do it and then pass it to some few pregnant women and see if they even actually have it instead of the fresh one and see the effects. But these things, as I said, Ewedu while you are in labor is you need to drink. You need to be hydrated while in labor. And that should be your drink. That should be your
Yeah.
go-to, you know. So if healthful remedy, if you want to add anything, please add it and then we can round up.
I don't really have much to add. I just want to say that your health is very much important than anybody's opinion.
Mhm.
Fine, there are husbands that we need to respect, but you need to, if you can actually present it to your husband, we are women. There are ways you present some things. Not that, hey, I must do this thing, and I will do. Even if you are the person, you will not agree.
Mm-hmm.
But we can sit to your husband and explain to this person that this money you want to use for surgery, we can actually use this one even to do shopping alone. It's like we'll buy something and or let's like if you shall show the men that there are other ways we can divert this money into. Let me try this thing now. Let's keep the money, let it be on standby. If this thing is not working, then I will agree to the surgery. You understand? So we should be the one to pacify them, but we are the one that will bear the scar. The scar will be on you. You'll be the one to go through the pain. So, and another thing is prioritizing your health. Ensure that you are healthy always,
Mm-hmm.
because on healthy life we bet on healthy pregnancy journey. You are
Yeah.
always doing everything anyhow you like with your body. You are not, in fact, if I'm taking cake now, it will be as if I'm eating poison. I'll be, hey, Ore, what are you eating?
Mm-hmm.
I'm always conscious of what I consume in. It will be as if I'm taking in
Mm-hmm.
poison. So it's not as if I'm being how do I put it now? It's just that I'm being conscious, because when it's time for that pregnancy, unwanted sickness or ailments, diabetes will not be
True.
knocking. High blood pressure will not be. You need to live healthy so that your pregnancy journey will also be healthy. So I pray that the Lord will help us all.
Mm.
And as time goes on, we'll share
Yeah.
more tips, and it only keeps getting better. We just started and there is room for improvement. So share more and it will really go a long way. Thank you,
Thank
Afribeta. Thank you
you.
so
Thank you.
much.
Thank you. I know it took so much and I've taken so much of your time, but thanks for, for
So
enlightening us
time.
tonight.
Right.
Yeah.
No problem. Thank
Yeah.
you anytime. So some other time we'll come on board. We'll do more publicity. Thank you and have a
Good.
blessed night rest. Thank you everyone.
And
Karen,
you too.
Dolce, Nielsen, Equipment, Sonia Media. Thank you. And for everyone that will be seeing this video, thank you
Yes.
so much.
Thank you.
God bless you.
All right. Have
Bye.
a good night.
And
Bye.
you too. Thank you.